So hi, I'm Evan Davies, PA with AllCare, and I'm here with Dr.Alisa Miller, who's a internal medicine physician with AllCare, and we're going to talk a little bit about coronavirus. Everyone's very scared about this right now. Dr. Miller actually survived it. How did it feel when you had COVID?
I didn't feel good, I will tell you that. I woke up with deep body aches, felt very unwell, had nausea, vomiting, little abdominal pain, low-grade fever. Definitely did not go to work. Called out of work rather, and I got a drive-through testing that day. After consulting with my colleague, she ordered it for me, and I got drive-through testing that day.
How long did it take you to recover?
I think over the first week, I needed a lot of extra rest. I really didn't have any appetite. So I really just got a lot of extra rest. I drank as much fluid as I could. And really after the first week, I was feeling better. And after the second week, I felt essentially back to normal, except for this annoying loss of smell and taste. So I do miss tasting my food. I will say that.
And how do you feel now?
I feel back to normal. I feel generally my energy is back, thank goodness, and all of my symptoms, my appetite's back. Again, I wish I could taste my food a little bit more, but I feel fully recovered and I feel well.
So are you getting some patients asking you if there's no treatment, why should they get tested?
Sure. So we're doing telehealth appointments. Anybody who has a symptom or feels sick or has who is concerned that they might have coronavirus, we're asking them to do a telehealth appointment and not coming into our clinic to risk exposing our staff. We want to talk to you via telehealth. That's the safest way to do it for everybody. Yes, this is a virus. We don't have an antiviral for this. This is not a curable disease, but it is largely a disease that we can supportively treat you through it. The value of getting tested is that not everybody ideally would be staying at home in a perfect world, but we have essential workers that are leaving their home to go and do their essential job. We have healthcare workers that are still among people. There are really people that would benefit from knowing if they are positive because they're not able to stay at home and quarantine as long as maybe the layperson would or somebody who's teleworking from home would be able to do. So that's beneficial. Also, if people know that they are positive, I think they're more likely to stay home and do the right thing and really isolate, because we know that the value of the test is to know that you're positive and know that you absolutely need to isolate and really protecting everybody around you.
Okay. So would you say the real danger is that people who maybe have a very mild version of this virus, or maybe even be asymptomatic and could be carriers, could be infecting people who could develop a more severe form of the disease?
I think that is absolutely the danger, and that is really the crux of the issue, and that is why we all need to stay at home as much as possible. There are probably many people who are asymptomatic or minimally symptomatic, and they are going and doing their normal things. They're getting coffee, they're seeing friends, they are still going to work. So staying at home as much as possible is the right thing to do to minimize the transmission and come into contact with the fewest possible people. That is the only way we can truly flatten the curve and reduce the amount of transmission in the community. We have to stay at home. Just because you feel well doesn't mean you're not a carrier. It's crazy and it's scary to think of, but it's true. And the truth is, generally, young, healthy people, not in every case, there are case reports where it's not the case, but young, healthy people will get this and they will clear this and they will do just fine. And the massive majority will do just fine. And that is wonderful. And we thank God for that. But the truth is, there are a few percent of people who don't do well. They decline, they deteriorate, they need to go into the hospital. We need to do the right thing to protect those people. My mom, your mom, our grandparents, our friend who's on chemotherapy. All of these vulnerable people need our help and need our help to do the right thing and stay home.
Very good. So if you have questions, give us a call. We're open. We'll do the testing. And the most important thing is not to panic.
Don't panic.
If you suspect you have it, we'll treat your symptoms and you'll probably be just fine.
All right. Stay safe out there. Call with questions.